Just the values that visiting nurse encompasses matched up with my personal values and why I wanted to become a nurse. So basically, compassion, quality care, and just really that family-oriented company. Every day that I go out and see a patient, my goal is to do whatever I can to make that person feel, welcome and even like a family member. So I kind of take on the motto, treat someone like I want them to treat me if that was my family member. So just taking along what your morals are, your values, and then lining it up with, again, what we're taught, what we're educated, what's basically instilled here at Visiting Nurse. Again, we do a lot of training, we do a lot of education with our clinicians. We have a strong education department here at Visiting Nurse, and then we have also our clinical supervisors that really help and guide our clinicians and just letting them know, this is what we need, this is the values that we instill here, and just consistently providing that support. Just making a difference, really. I love helping people, which is why I chose nursing, but really just seeing a wound from the beginning and seeing it progress, and just knowing also that I've helped a family member. And then even outside of helping family members, I enjoy educating our clinicians. So it really is rewarding for me when I can see clinicians not necessarily having to call on me because they've been out with me on another visit and they remember some of the things that I've shown them and taught them, and just being able to grow from that. So really just being rewarded by knowing that I've made a difference in someone's life. I take everything kind of personal, and it's hard not to. I mean, as nurses, we do that anyway. That's part of our compassion and empathy. So at that, pretty much when I see family members going through, I give them hugs. I don't mind doing that. And we've wiped away tears, but just really reassuring them that it's going to be okay, that they're not alone, that they're not the only ones that have gone through this. Because a lot of times you kind of feel like, as a caregiver, probably you feel like, I'm in this by myself, nobody understands my struggle. So I really try to give them a lot of encouragement. Well, I try to definitely, there's been some tear jerkers, I'm not gonna say I'm not human, because I've gone and I've cried with patients. Definitely it's just part of the job. But pretty much I also have a family as well, so I definitely try to, separate a little bit from that. But I do walking, definitely very spiritual for myself. So a lot of prayer, I do that, first thing in the morning anyway. I'm praying always, what is it I can do? How can I be a vessel to help someone else? Like I said, it just lined up with what I was looking for. And then the idea of support, knowing that, because the agency that I came from, we were like a big family. Although Visiting Nurse was a lot larger, but it was just that, feel of warmth. I met with, at the time, was one of the social workers, was just warm, didn't know me from anyone else, and just gave me a hug, and just saying, I want you, to feel like if you do come to this company, that we are here to support you, and just some of the things coming from a smaller company, it was a lot. We were working on paper, so Visiting Nurse also was very high tech at that point, and always kind of keeping up with technology. So I was very excited about that. I would definitely say for any nurse or anyone that's interested in home care, there's some challenges out there, but especially if you're coming from a new background, just to know that we here at Visiting Nurse support you. If you're looking for an agency that's going to support you and stay on top of the new ideas going on in technology and in home care, this agency is one that definitely does that. We support, our clinicians in any way that we possibly can. We listen, and again, one of the things here is it allows growth. So again, for anyone that's looking for, different opportunities, this company also allows for that as well. We service so many people here at Visiting Nurse. So as far as the acuity level, we have a lot or a higher acuity of patients that we service. But again, we are supportive of our clinicians. So that's another thing. You get a lot of experience here. Versus something that may just be, I'm going to go out and see a wound. So every patient is just not as basic. There's always something that's different, and then also it's a challenge as well. So it requires you to really put a lot of thought into what you're doing. But again, the support is here. It's a great company to work for, and like I said, it has to be. I've been here for 10 years. My counterparts, I love, even the higher management, because again, they're always there supporting me in everything I do. So, like I said, just coming from just different areas here at Visiting Nurse, I'm where I have always wanted to be. I'm doing what I've always loved, and I can't imagine doing it anywhere else.